In this video, we're going to go through the bones of the upper extremity. The first few slides of this PowerPoint, it's this one over here, this one over here, this one over here. These go through bone markings. So some of these terms we've covered already. For the ones that we haven't, please make sure you go through those. Probably the best way to learn these is just to quickly review these tables. Table 7.1 over here, and over here. These are the first three slides in the PowerPoint. And then as we come across them, you'll see the application of those terms. All right, so to start off with the upper extremity, let's look at the clavicle. So that this bone over here, your collarbone, is called the clavicle. So from here on out, you must call it clavicle. You may not call it collarbone, okay? When we look at that, if we zoom in a little bit, we're looking at the right clavicle. This is a bird's eye top-down view, and we see two ends to it. This is one end over here, this is the other end. And so this medial part is called the sternal end. And why is it called that? Because it articulates with the sternum. This bone, this end over here is called the acromial end. And you'll see that the reason for that is because it's going to touch a part of the scapula, which we'll see eventually, which is called the acromion. If you remember from the very beginning of the course, this is also, remember that the acromial region is in this neighborhood. Okay, so this is the acromial end or the lateral end. The terms you must use are the sternal end and the acromial end. If you were to pick this up and twirl it around, you'd see that the sternal end is a little bit more circular, whereas the acromial end is a little bit more flattened out. The only other part that you need to know is that if you look towards the acromial end, what we're going to do now, we're going to switch to an inferior view, is that there's a little bump there. Remember that the word for bump is tubercle, and this is called the conoid tubercle. If we drag our word list over, we see that for the clavicle, we have the sternal end, acromial end, and the conoid tubercle. And that's it for the clavicle. Let's move into the scapula. So the scapula is also known as the shoulder blade, but again, shoulder blade is really the kind of layman's term for it, and so the term you need to use is the scapula. When you look at the scapula, the reference point, the important landmark is this thing in the back. This is the posterior view, and this thing is called the spine of the scapula. And so when you look at the spine of the scapula, there are going to be a few things that are in reference to the spine. So there's the spine. Remember the word for shallow depression? The word for shallow depression is fossa. So right above the spine is a shallow depression, and that's your supraspinous fossa. Above is supra, spinous, referring to the spine, and fossa meaning shallow depression. And what you should know for now is that the supraspinatus muscle lives here. We'll look at that muscle down the road, but hopefully this is going to make things make sense. Supraspinatus, supra is meaning supra, spine, muscle lives in the supraspinous fossa. Right below the spine is the infraspinous fossa, and then there's a muscle that lives there called the infraspinatus muscle. And so on your bone list, I have these terms, the scapula, there's the spine, supraspinous fossa, infraspinous fossa. So the other thing that I'm seeing right now is not actually in your list is, and I don't know why, we should have the term here, subscapular fossa. I'm sorry about that. Subscapular fossa is also should be on your list. And so when you turn this around on the anterior view, this depression, and this it doesn't really look like a traditional fossa that you might see, but we're going to call it a shallow depression. This is the subscapular fossa. This is on the anterior side, and the subscapularis muscle lives there. So again, as you're watching these videos, you really should add this term on subscapular fossa. Should have been included in the list from the beginning. So supraspinous fossa, infraspinous fossa, and subscapular fossa. Now let's talk about a few more other parts here. The acromion, the coracoid process, and the glenoid cavity. See, the acromion is this piece out here. It's a big chunk of bone that lives out to the side, and you can touch that easily if somebody pats you kind of on the top of the shoulder. That's your acromion. And remember that the acromial end of the scapula, this is sorry, not of the scapula, of the clavicle. The acromial end of the clavicle, which is right over here, is going to articulate with that acromion. All right. So this part right over here is the coracoid process. Coracoid process is that thing that sticks out there. If we take another view at it from the anterior view, this is your coracoid process. And you should know that the pectoralis minor and the biceps brachii muscle attached to this point right over here. The pectoralis minor and biceps brachii muscle attached to this point. Okay, and we'll see those muscles again in more detail when we actually get to the muscle unit. And we'll talk about what the subscapularis does, supraspinatus, all these muscles in green. We'll talk about that when we get to the muscles. For now, I recognize it's a bit of memorization, but just go ahead and memorize those things. So there's the acromion, the coracoid process. The last part is the glenoid cavity or the glenoid fossa. And so what happens is if we turn this to the side and look at it from the lateral view, we're looking at the right scapula from the lateral side. There's the coracoid process, there's the acromion, and then the spine. It's hard to see from back here. But to this side right here, this is the glenoid cavity, also known as the glenoid fossa. So what ends up happening is that the head of the humerus will actually articulate with this section right over here. And that's going to make up your shoulder joint, your glenohumeral joint. So again, we've covered the spine, the supraspinous fossa, the infraspinous fossa, the subscapular fossa, which again, I just added in. Make sure you add that onto your list. The acromion, the coracoid process, and the glenoid cavity or the glenoid fossa. So those are all the parts to the scapula. All right, as we move on then into the humerus. When we look at the humerus itself, you'll see that the humerus has lots of named parts. So the list itself seems a little bit long. When you look at the humerus, there's all these parts, A all the way through J. But if you take it step by step, I promise you it's really not too bad. So when you look at the humerus, let's get our orientation. There's the proximal part and the distal part. This is the head of the humerus, and down over here is again the distal end, which has a bunch of named parts. So let's just work our way down from proximal to distal. So we see the head of the humerus. What does the head of the humerus articulate with? It's going to articulate with the glenoid cavity or the glenoid fossa here of the scapula. When you look at that head, if you were to come up close from the anterior view, there's two bumps here, and one is bigger than the other. This is the greater tubercle, and this is the lesser tubercle. Greater tubercle and lesser tubercle. Right in between those two bumps, those two tubercles, is a groove. And this groove over here has a name. It's called the intertubercular groove or intertubercular sulcus. So again, if you break this down, inter means between. Tubercular refers to the tubercles. So this is the groove in between tubercles. Okay, so greater tubercle, lesser tubercle, and this is the groove in between the tubercles, intertubercular groove. So the biceps tendon, which is part of the biceps brachii muscle, actually sits right within here. We'll look at it more closely when we get into the muscles, and we'll see that the biceps tendon sits there, and it's the design of this thing is for the biceps tendon again is going to sit right over there, and what will happen is that the biceps contracts and relaxes. This thing will kind of slide up and down within that groove. There's the biceps tendon sliding up and down within there. Okay, if we look pretty much almost midway through the diaphysis is another big bump, and the big bump we're going to call a tuberosity, and there's the deltoid tuberosity. Guess which muscle attaches to the deltoid tuberosity? And it's called the deltoid muscle. So here we are, we're at the head. We cover the head, greater tubercle, lesser tubercle, intertubercular sulcus or groove, and the deltoid tuberosity. So now what we're going to do, we're going to move our way down, and we're going to move distally. So as you move distally, I want you to notice that here we actually have two condyles. We have a medial condyle and we have a lateral condyle. Remember what a condyle is? It's a smooth, rounded projection. We've seen them before, like in the mandibular condyle and the occipital condyle. And distally here at the humerus, we have two condyles, medial condyle, lateral condyle. Now, what you'll see in the humerus, they actually get their own name. If you recall how like C1 of the vertebra had its own name, it was atlas. C2 had its own name, it was axis. Well, here the medial condyle and lateral condyle, they get talked about enough that they also get their own names. So the medial condyle is also called the trochlea. The lateral condyle is also called the capitulum. And so what attaches there? Well, the trochlear notch of the ulna is going to wrap around the trochlea, and then the radial head is going to articulate with the capitulum. We'll see that as we move our way into the forearm. This will be the forearm. Just to give you a preview, there's the trochlear notch of the ulna, and there's the head of the radius. Those are the guys that are going to articulate with the medial and lateral condyles, okay, the trochlea and the capitulum. Now, there's a prefix epi, and epi means kind of surrounding or around something. We'll see that down the road. We'll see things called like epimysium and epineurium. Here we have something called an epicondyle. What does that mean? It's this thing that's near or around the condyles, and it's a bump just in the neighborhood of the condyle. So this is the medial epicondyle, and on the other side, maybe you better see it from the posterior view, is the lateral epicondyle. So there's a medial epicondyle here and a lateral epicondyle. You can actually find this pretty easily if you look at your elbow and you look at the crease of the elbow, and as you flex your elbow, if you were to follow those creases out towards the inside, you'll touch the medial epicondyle. If you follow that crease out to the outside and you dig in a little bit through some of that muscle, you'll find the lateral epicondyle. So there's the medial and lateral epicondyles. Now, right up here, are two fossas. There's a coronoid fossa and a radial fossa. And again, I know it seems like a lot here, but hopefully as you continue to learn the bones, this will make more sense. Well, the radial fossa is right over here. And remember that you got a fossa for some reason. What slides into that fossa? Well, the thing that's going to slide in is the radial head. The head of the radius, when we get down into the forearm, there's the head of the radius. When you flex your elbow, if you were to flex your elbow, this bone will actually slide right into the radial fossa. So then you got another fossa right over here, and then logic would dictate, well, I mean, I guess when you flex your elbow, something needs to slide in there. It's probably called a coronoid something, since this is called the coronoid fossa, and you would be correct. What you'll see is that this part here is called the coronoid process of the ulna, and the coronoid process of the ulna slides into the coronoid fossa of the humerus. Okay, so radial head slides into the radial fossa when you flex your elbow, and the coronoid process of the ulna slides into the coronoid fossa when you flex your elbow. If we flip this thing around, we'll see a couple more things. The radial groove you don't need to know. That is not on your list. The deltoid tuberosity I've already pointed out. The only new thing here is the olecranon fossa. And again, it's just another fossa, shallow depression. So you're asking yourself, well, if it's a fossa, what slides in there? And the name would suggest there's something out there called the olecranon. And you'd be right. The olecranon, or the olecranon process of the ulna, slides into that during elbow extension. So if you look here, this thing is the olecranon. This will move us naturally into the bones of the forearm. And so if we look, let me zoom in on the ulna. If we zoom in on the ulna, there's your olecranon right over here. Oops, this was your coronoid process. You're seeing kind of a C-shaped structure over here on the ulna. So this part over here is the olecranon. The surface that if you could rub your finger right along that surface, is called the trochlear notch. And this anterior lip is called the coronoid process. Now, we've seen kind of homologs to these things up on the humerus, right? So the olecranon slides into the olecranon fossa of the humerus during elbow extension. The, trochlear notch wraps around the trochlea. And the coronoid process of the ulna then will slide into the coronoid fossa. Okay. So you should see that these things really do come together. So when you look at the list, again, it's in your interest to try to make a lot of this stuff make sense. When you look at that radial fossa, again, the radial head will slide in there. When you look at the coronoid fossa, you know why it's named that. And same with the olecranon fossa as well. Okay, so at this point, let's see, we've covered, on the upper extremity list, we've covered the humerus and all the different parts of the humerus and the scapula and the clavicle. So why don't we cut the video here, and we'll continue on and wrap up the upper extremity in another one.